Hit record. Hello, good evening, everybody. Welcome to our Tuesday evening, our deeper dive on the nutrition side of things. And we've covered just recently the basics, which is your cellular health. And now we're going to get into the parts that cause a lot of disease, what we know as disease. And any time that you have an imbalance in the body, as we all know, nature loves balance. So anytime that we have an imbalance in the body, we are going to have inflammation. And inflammation causes all sorts of fun stuff in the body. If you can imagine a pot full of popcorn kernels, if it's sitting on your stovetop, nothing's happening until you put some heat on there. And then all sorts of funny things happen. It pops up all over the place. And our bodies work pretty much the same way. So we are generally sitting there, everything's working correctly, and then suddenly there's an issue. There's an imbalance, and inflammation rears its little head. And I'll go through the presentation and introduce you to all of that as to what causes it and why, and what we can do about it. So be aware, this is going to be a session that is going to take more than just the 35 minutes that I've got to play with over here. Let's just hide this. And hide everybody else over here. Right, so chronic inflammation. If you develop a fever, that's inflammation. Might be because you've got a cold, you've got a flu, you've got something, but it's there and it disappears again. If you happen to be walking down the stairs and in the vast amount of floods that we are going to be having fairly soon, and you slip on the top step and you twist your ankle, immediately there's swelling and there's inflammation. That is a good thing. It's not a problem. However, it's the chronic inflammation. So imagine a blowtorch. If somebody waves a blowtorch in your face and just goes whoops past your face and you duck back, you're probably not going to have too much of a problem. But if they hold it there, you're going to have a big problem. And that is what chronic inflammation is. In your car, chronic inflammation is rust. So to put that into perspective, that is exactly what your chronic inflammation causes, is rust. Now, I have borrowed a lot of this talk from the Cleveland Clinic newsletter. So the first part of the story is, what is inflammation? We all have heard the word. We've heard of anti-inflammatories. What is inflammation? When your body encounters an offending agent like viruses, bacteria, or toxic chemicals, or suffers an injury, it activates your immune system. Remember that security system in your body? I'm sure most people in here have got an alarm system on their house. And if you leave home to go to a presentation or go to the shops or whatever, you set your alarm. Generally, nothing happens unless somebody tries to break into your house and they break the beam. That triggers the alarm. And that is very much how our immune system works. It's there, it's always around, but unless a virus, bacteria, toxic chemical, injury, foreign body comes about, your immune system just lies there doing nothing. But as soon as something foreign comes in, it kicks in and triggers an alarm. So your immune system sends out its first responders, which are inflammatory cells, and cytokines, which are substances that stimulate more inflammatory cells. So think of a car accident and you phone for help. The first person on the scene is what's known as a first responder. People who work in the ambulance department or work in the medical field will understand what a first responder is. First responder is your paramedic who gets there, assesses the situation, and decides how many boxes he needs. So that is what the inflammatory cells do, is they trigger out, so your inflammatory cells get triggered, and the cytokines are there, and they assess the situation. These cells begin an inflammatory response to trap the bacteria and other offending agents, or start healing injured tissue. So your alarm's triggered, and your alarm company sends out one vehicle to go and assess the situation. Should there be discovered now that there's a few other people around there, he's going to call for backup. We had that situation outside our house a little while back, where there was an issue at about 2 o'clock in the morning, and sent a message. Somebody came to check, and when I went out because I was called to go and assess the situation as well, or to help with the situation, when I went out, there were 10 vehicles there. So very much the same. You have a single response, and then all of a sudden you have this massive response. Then the result of this can be pain, swelling, bruising, or redness. If you've ever twisted an ankle or sprained your wrist, you will understand what I'm meaning with this. But inflammation also affects body systems you can't see. Remember, our body is made up of a whole lot of different organs and things, not just one or two things. So what is the difference between acute inflammation and chronic inflammation? Acute inflammation is the response to sudden body damage, such as cutting your finger or spraining your ankle. To heal the cut, your body sends inflammatory cells to the injury, and these cells start the healing process. Chronic inflammation is when your body continues sending inflammatory cells even when there is no outside danger. So imagine your alarm system has a bit of a short circuit, and it just rings and rings and rings, or triggers the alarm and sends out the signals continuously, even though you're at home, you know that there's no problems, it's had a bit of a short circuit. For example, in rheumatoid arthritis, inflammatory cells and substances attack joint tissues, leading to an inflammation that comes and goes and can cause severe damage to joints with pain and deformities. As I said earlier, before we started this meeting, we were talking about, is it going to rain tonight or is it not? And I jokingly said, ask somebody who has arthritis, because people with arthritis who have had injuries will tell you very quickly if there's going to be rain later, because their joints ache. So acute inflammation may cause flushed skin at the site of the injury. Think of sprained wrist, sprained ankle, pain or tenderness, and swelling and heat. So if you touch that ankle that is now giving a very good imitation of having a little squash ball under the surface, you will feel that it is warm to the touch. As I often say to my patients, if you drive your car and you happen to have a sudden stop against something hard, your airbag is probably going to trigger. We don't have airbags, thank heavens, but we do have water bags. And that is where, when you have an injury, you have this swelling that happens. That is essentially your airbag. Now, chronic inflammation may be harder to spot than acute inflammation, because this includes things like abdominal pain, chest pain, fatigue, and it's that chronic fatigue. It's not just waking up feeling as though you haven't had enough sleep. It's waking up feeling as though you haven't woken up and had enough sleep all day, every day, for weeks or months on end. Not a fun situation to be in. And there's fever, like in TB, for instance. Joint pain or stiffness, such as rheumatoid or osteoarthritis. Mouth sores. So there's a lot of little sores and things that form around the lips and sometimes on the tongue, and that you'll see in things like an HIV infection. A skin rash. So this would be things like your eczema, psoriasis, that kind of thing. Those are all chronic inflammation. And it is involved in the disease process of many conditions, such as Alzheimer's disease, asthma, cancer, heart disease, rheumatoid arthritis, and ankylosing spondylitis, which is a similar sort of thing, and type 2 diabetes. So whenever you see inflammation, it is a symptom. Like a headache is a symptom of anything from dehydration to a brain tumor. You have the headache, you don't know what's causing it. Somebody has to diagnose it. And this is where a medical professional comes in, because they are taught to diagnose something. If you sprain your ankle, you can pretty much figure out that it's a sprained ankle, but you need somebody to diagnose if you did a really good job and tore the ligaments, or was it just a strain? Or did you do an even better job and break a bone? That needs more in-depth diagnostic tools to make that end diagnosis. So when you have chronic inflammation, it can trigger symptoms, which are common to quite a few different things. The most common reasons for chronic inflammation include things like autoimmune disorders, such as lupus, where your body attacks healthy tissue. Exposure to toxins like pollution or industrial chemicals. People who live in cities and sorry, I'm getting feedback over here. People who live in cities near an industrial area. So think of when you're coming into Durban through, I'm not too sure where that industrial area is, where the car factories and things are. People who live in that area would battle a lot with pollution and industrial chemicals. People who work in those factories would battle a lot with industrial chemicals. Untreated acute inflammation, such as from an infection or injury, and some lifestyle factors also contribute to inflammation in the body. You may be more likely to develop that chronic inflammation if you drink alcohol in excess, if you have a high BMI. Remember we spoke about that just recently? It falls within the ranges for obesity, unless that is a result of being very muscular. You remember my talk from a couple of weeks ago, apologies, on obesity, where we spoke about BMI. And we said that BMI is currently the recognized diagnosis of obesity. But BMI can also be a factor for certain athletes, like boxers or bodybuilders, even rugby players for that matter, because they are solidly built. So BMI is calculated according to ratios, but people with a lot of muscle will also fall within those ratios that indicate an elevated BMI. So exercise at your maximum intensity too frequently, or you don't exercise enough. Either one of those things will cause inflammation as well. You experience chronic stress, and this is very common in the business world these days. And if we look at the news, I don't know if it's been on the news because I don't look at the news, but I've seen on my LinkedIn posts just recently, there have been mass layoffs. Something like 16,000 people have been laid off, have lost their jobs overnight. And they woke up, went to their laptop to log in, and were denied access, only to have a message come up on their phone saying, thank you very much, you're no longer employed. Please do not try and access your emails, your duty station, or anything else. You no longer work here. That's quite a shock to the system. And that could cause stress, because now, as I say, there are 16,000 people, and these are not just street sweepers or your domestic workers. We are talking highly qualified people in specialized areas that are suddenly looking for jobs. And they've got just a couple of months in which to get back to the lifestyle that they've gotten used to. People who smoke also have problems with chronic inflammation. So how is this issue treated? First of all, it doesn't always require treatment. I always like to find out what's causing the problem. So for acute inflammation, which is your sprained ankle or sprained wrist, rest, ice, and good wound care often relieve the discomfort in a few days. So you've had to go into hospital for surgery, minor surgery, and of course the definition of minor surgery is any surgery somebody else is having, but you've had to go into, for some other minor procedure, you're going to have inflammation. So rest, ice the area, good wound care, and your inflammation subsides very quickly. If you have chronic inflammation, your healthcare provider may recommend certain supplements. So certain vitamins like A, C, D, and supplements such as zinc may reduce inflammation and enhance the repair. For example, your healthcare provider may prescribe a fish oil supplement and/or vitamins, or you may use spices with anti-inflammatory properties, such as turmeric, ginger, or garlic. Do any of these things sound familiar to those of us in this team? For guests, we'll introduce them to you later, but for the team members, do you see where these vitamins and minerals come into play? And in my opinion, your omega-3 or salmon oil is probably one of the best natural anti-inflammatory products you can get on the market today without any of the funny side effects that your drug anti-inflammatories will have. The other thing that they prescribe are what's known as NSAIDs or non-steroidal anti-inflammatory drugs. And these over-the-counter medicines lower inflammation. Your healthcare provider may recommend things like ibuprofen, apologies, which we would equate to things like Panado, aspirin, and naproxen. Other things like steroid injections. Corticosteroid shots decrease inflammation at a specific joint or muscle. So you've got an inflamed knee, you go to your doctor, and he's going to inject you with a cortisone injection. You've got tennis elbow, they're going to do the same thing. So the example that they use here is if you have rheumatoid arthritis that affects your back, your healthcare provider may give a steroid shot in your spine. You should not have more than 3 to 4 steroid injections in the same body part per year. And again, my opinion, but if it's a ligament area or ligamentous type injury, like a tennis elbow, for instance, I wouldn't suggest more than 3, because otherwise that cortisone tends to jellify the ligament, and then you end up with a lot more problems. So basic first aid, maybe I should get my sister Jenny to kick in over here and explain about basic first aid for inflammation. You need to, first of all, follow an anti-inflammatory diet if this is systemic inflammation. Some research shows that people who follow a Mediterranean type diet have lower levels of inflammation in their bodies. You may also choose to eat more foods that have anti-inflammatory properties, such as oily fish, for example, mackerel, salmon, or sardines, leafy greens like spinach and kale, olive oil, tomatoes. Eating too much of certain foods may increase inflammation as well. If you have chronic inflammation, you may feel better if you avoid things like fried foods, in other words, junk food. Cured meats with nitrates, such as hot dogs, bolognese, cured ham, biltong, etc. Highly refined oils and trans fats. Again, that stuff that the fast food is cooked in. And refined carbohydrates such as sugar, pastries, or white bread. All of those will trigger the inflammation. So how do we prevent this? You may decrease your risk of chronic inflammation by developing healthy lifestyle habits. Some of these things include achieving and maintaining a healthy weight, avoiding or quitting smoking. Personally, I only smoke when I'm on fire, so if you do smoke, as Charlie likes to say, because he used to be a smoker, he said he wasn't a smoker, he was just the sucker. So if you know any suckers, encourage them to quit. We need to exercise 3 to 5 times per week, at least. In other words, every day. You can have rest, and you obviously need to rest, but do some form of exercise, even if it's walking around the block, which you kick under your bed afterwards. But even if it's just doing a short walk, running up and down a flight of stairs, every single day of the week, you will feel significantly better. You need to limit your alcohol intake to a maximum of 2 ounces per day. Not too sure how much that is, but I would say probably a glass of red wine is okay, specifically if you have a cardiac condition. Me personally, I don't touch alcohol because I've never liked the stuff. But you can, for those who do enjoy it, keep it to a minimum. Too much of anything is bad for you. And you need to manage stress with healthy tools such as meditation or journaling. And I will say, I find doing my park run on a Saturday helps me tremendously to de-stress. It's fresh air, it's exercise, it's movement, and it's getting to meet other people and just shouting out to a friendly, "Hi, keep going, you're doing well." By encouraging others and having other people encourage you, it's amazing how quickly your stress levels drop. Now, obviously, there's certain conditions where you need to see your doctor. You need to check in with your healthcare provider if you experience a worrisome injury, that sprain that doesn't get better after about 48 hours. And you need to also talk with your provider if you have ongoing pain, swelling, stiffness, or other symptoms. A healthcare expert can narrow down the cause and find ways to help you to feel better. In other words, find the cause, take care of the problem. And a note from the Cleveland Clinic: inflammation is an essential part of your body's healing process. It occurs when inflammatory cells travel to the place of an injury or foreign body like bacteria. If inflammatory cells stay too long, it may lead to chronic inflammation. Chronic inflammation is a symptom of other health conditions such as rheumatoid arthritis. Your healthcare provider may recommend medication or at-home management. You can reduce inflammation by eating anti-inflammatory foods and managing stress. If in doubt, please consult a registered physician who is trained in this. From a diet perspective, if in doubt, please consult a registered dietitian, preferably someone who's familiar with supplements, or go and see a registered clinical nutritionist, because that way they can guide you as to what and what not to eat. Sometimes all it takes is somebody having a set of outside eyes look at your diet and your lifestyle, and they can see immediately where the problem is and guide you accordingly. And this is the job of a coach, and this is our job, because we are coaches. If you see the way the new system is being rolled out overseas, which I do expect will possibly come out over here at some stage, they are training us to be health coaches. So it doesn't always have to be genetics that causes this chronic inflammation either. So lifestyle, environment, physiology, and biochemistry are the cause of 70 to 90% of chronic disease. In other words, these are things that you can control. Genetics you can't control, unfortunately. It's not our fault that our parents met. However, the physiology, the biochemistry, the environment, the lifestyle, those are things we do have under our control. And if that's where chronic disease comes from, then I guess we need to take a pretty close look at these things in our life. Now, inflammation, chronic inflammation causes other issues because it damages blood vessels, amongst other things. So an anti-inflammatory diet would include things like reducing inflammatory fats, your junk fats. We need to eat fish or seafood. We need to reduce sugar and refined carbohydrates. This is common stories coming through yet again. And we need to eat more colorful and fiber-rich veggies, fruits, and legumes. And antioxidant protection is produced by the body from food. So in other words, once again, as we've always said, supplements do not cure a problem. They give your body the tools for which your body can then use to protect itself and produce these antioxidants. So if you give your body the correct tools, it becomes a miracle fighter. And just out of interest, this little slide that I'm showing right here comes from the Cleveland Clinic. It is not mine. It does not come from Neolife. Can you see where this features in the products that we are so familiar with and the stories that we are so familiar with? Think Pro-Vitality. In today's lifestyle, we have a high ratio of omega-6 compared to omega-3, and this is associated with disease. Let's see if I can move this picture away. We should have a ratio of 4:1. Jim McAfee often says, or in fact, no, it was Don Lawson, sorry, who said the ratio should be 1:1, so 1 part omega-6 to 1 part omega-3. Unfortunately, this ratio has become a little wonky. As we can see over here, omega-6, your pro-inflammatory, comes from foods made with and animals fed corn, cottonseed, soy, safflower, and sunflower oils. Your anti-inflammatory diet is things like fish, seafood, chia, and flax seeds, pastured livestock, in other words, your free range, including grass-finished beef, wild salmon, and sardines. Have a look at this slide. Have a look at your grocery cupboard. Have a look at the labels on the things in your grocery cupboard. Of the omega-6, how many of those are in your cupboard? And that, I think, is where I'm going to stop, because I'd like to leave us a little bit of time to answer some questions if anybody has any, before we get into the next part. We always hear that fat is bad for you. You mustn't have fat. Surprise, fat isn't the enemy. Does anybody have any questions or comments before I stop the recording?